get started because we've got quite a tight agenda, and I'll begin by introducing myself. I'm Kate Sutton, and I'm one of the assistant directors at the Council for Disabled Children, and going to be chairing this morning with some colleagues from working for the Council of Disabled Children on the RISE partnership programme. So it's lovely to have you here today. The webinar has a focus on SEN casework teams. But we have hopefully upwards of 100 people joining us this morning, representing casework teams, EHCP coordinators, SEND officers, parent care ambassadors, inclusion officers, SEND advisors. So a broad range of people joining us to help us have rich discussions when we get to the Q&A and the breakout rooms. So just to let you know that we are recording the session so that people are able to catch up afterwards or to watch if they're unable to join. We will be asking you to remain on mute unless you're a speaker, and I believe that you'll be spotlighted if you're a speaker. We would like you to use the chat function rather than raising your hands with questions, and we will be monitoring the chat, and we'll be picking up on the questions that get asked. Just to let you know as well that we will be finishing promptly at 5 to 12 to enable you to complete the evaluation form, which we really value you completing. There'll be information on screen and also in the chat at that point. And there are some helpful tips on the slide at the moment from a housekeeping perspective in terms of managing teams. Thank you. So we have a number of objectives. Maisie, if we could move to the next slide, for our session this morning. And we're lucky enough to have 2 researchers from Leeds Trinity University to share some research that they will have conducted on developing local authority SEND assessment and review teams in the Yorkshire and Humber region, and how this has been used to inform their work locally, and I'll be introducing them shortly. And we also have an opportunity to hear about the themes that are emerging from the regional case team manager workshops that have been led by the CDC during October and November. But there's also an opportunity to sort of reflect together through the breakout rooms on becoming more supportive and more responsive SEND teams, and an opportunity also to develop a shared understanding between partners about the challenges and opportunities faced by everyone to support this workforce. So hopefully we're looking forward to some really rich discussions. We will have a breakout groups at 11:10, and each of those groups will be facilitated by somebody from the CDC. There will be somebody who remains in the main room, so if you do have difficulty joining, there'll be an opportunity to have the support that you need to join the breakout rooms. Somebody will also be monitoring the inbox as well, in case that there are other issues that you want to sort of check in and have resolved to sort of ensure that you can continue to join. Macy, have I missed anything from a kind of houseworking point of view or a SEND objectives point of view?
No, I don't think so. But just to say that there's obviously too many of us to do introductions. But if people want to pop their name and where they're working from in the chat, then that would be great.
No.
Thanks, Kate.
Thank you. Thank you. So please start to do that. We are already at 106 people, which is great. And I'm sure we'll possibly have a few more joining because we are only still at 4 minutes past 10. So there are our objectives for the day. We have got a rich mixed group of people, looking forward to having some rich discussions. And I'm going to hand over slightly early, but still think it's worthwhile to do so, to to Dr. Tracy Laverick and Dr. Richard Barron, who are the researchers who have been conducting this research in the Yorkshire and Humber region as part of their work at Leeds Trinity University. They're going to be sharing their own slides, and also will be introducing themselves and their wider work a little bit as well before they talk us through the research and their findings. Following that, at 11 o'clock, we will have an opportunity for a Q&A. So please do think about the questions that you want to ask and add those into the chat, and then we'll have an opportunity to sort of open up the discussion at that point. So Tracy and Richard, thank you very much. Over to you.
Thank you. I will just take a moment to share the slides and get that working, hopefully. Can you let me know? Can you see those?
Yeah, we can see those, Tracy.
Yeah, I can see them.
Thank you. And thank you to everyone that has put their names in. There were so many actually that it was covering me being able to turn my mic on. I wasn't quite sure how to get rid of all the notifications, but that's absolutely brilliant. So thank you. And we're really privileged that you've taken the time out to come and listen to this research that we have been doing over the past 2 years. So I'm Dr. Tracy Laverick. I work here at Leeds Trinity University 3 days a week, and I teach on the SEND Award, and I also teach on the Masters in Children and Young People's Mental Health. And what I do with the other 2 days a week is I actually work for a local authority within the Yorkshire and Humber region as a senior educational psychologist 2 days a week. So I have sort of this dual role, and that's actually been amazingly helpful because we have been able to make those links really quickly and work very fast on actually doing the research and having we managed to do a pilot which I'll talk you through a little bit before we then went out to the whole region. And then we're also now instantly being able to build on some of the workforce development stuff that's come out of the research, which we're going to share with you at the end of this presentation. So this isn't research that is just standalone. This is research that is instantly sort of trying to filter into what we're doing with the workforce, with the SEND teams. Richard, do you want to introduce?
Yeah. I was first of all, I was just looking at the chat and just seeing the volume of SEND casework officers in the meeting today, which I think is great. You know, this is all about you, and it's all about the perspectives of SEND casework officers. So I think that's really great that you come here to listen to this research. Yeah, I'm Dr. Richard Barron. I'm the program leader for the MA in Mental Health and Children and Young People at Leeds Trinity. My main sort of areas of interest from academic sort of research sort of backgrounds tend to be focused on evaluation of psychological interventions in schools, and that could be anything from psychotherapy interventions, counselling, and so on, but also looking at how psychological ideas are implemented in real world settings. So my PhD thesis was about how growth mindset was implemented in a primary school setting in a deprived area. Currently, in addition to the current research, I'm also advising on trauma-informed practices across West Yorkshire with West Yorkshire Health and Care Partnership. I'm sort of acting as a mentor to some of the fellows on their adversity, trauma and resilience framework program there they have in their public health department. And I'm also doing some speaking on working with SEMH needs in schools to school leaders and and teachers and so on is an area that I also do work on. I suppose that's a brief summary of me and what I'm doing.
Okay, thank you. We wanted to give you a little bit of context of how we got to be doing this research, because it hasn't come out of nowhere. It's actually been something that I've been working on for quite a long time. My main area of research, training to be an educational psychologist and doing my thesis, was actually around how people and systems work or don't work well together. And systems are always made up of people putting in place processes, but you can't ignore the fact that there are people at either ends of that. And so this started off with me looking at setting up multi-agency support meetings in SEMH specialist provision to try and look at how we could work. The parents there were often seen as hard to reach, and I was there going, well, how can we tip that on its head and make us easier to access? Because actually that's what we should be doing. So I researched those and did some focus groups and got some really positive feedback, specifically from the parents as well as the agencies that were working. So then I went on to my thesis, which was around parents' experiences of having a child with SEMH needs in the early years, as to how we communicate with parents when the children are still quite young, in order to try and address some of these trajectories then into permanent exclusion as they're getting older, and think about, are we putting the right support in around the child, around the family when they're at that earlier stage. And one of the key things that I developed a model from that, and one of the key things that came out of it was it didn't matter actually how knowledgeable the parents were about the education system. When they were accessing as a parent, they were external to the system. And so I was trying to have a look and think about how we can improve the system, improve the processes that are in place in order that actually we can start to make work more collaboratively together. And then when I was thinking about that, and I'd looked at these elements of the school and the parents and some of the challenges the parents were having, we were then thinking, right, well, what often happens then is the parent goes to the local authority if they're not actually getting anywhere with the school. This was the examples I had from my research. And actually I was there thinking, but we don't know. So the SEND officers are absolutely vital in the EHCP process, in the assessment process, even in some of those really early conversations. But there was nothing. And there's nothing about, there's nothing in the legislation. It always says the local authority. It doesn't ever identify local authority SEND teams specifically. I think there's one sentence that actually mentions officers, and that's it. And I think for me, if you're going to make a system that's going to work well together, you've got to acknowledge the people within the system and the pressures that are on the different people within the system. And by understanding those, this is why it's about a shared understanding, is actually we need to put the shared understanding together in order to move forward. So anyway, we did a literature review. We found that there was very little on SEND officers and their views at all, particularly since the changes, but even before then. So we realised there was a big gap in the literature. So I went to my local authority and asked if we could do a piece of research jointly, and that they would be our pilot study. So we actually started this back in 2021, got a small pot of funding in order to put this pilot study into place. So we did it on a small scale with about 13 officers, and then made some changes based on that pilot. And then in 22-23, so it was in December of last year, we actually then put the survey out to the wider group. We made it a survey so that it was quick and easy, because the one thing we were really aware of is that there's a lot of time pressures. And one of the key things, actually, what was interesting in the pilot is I didn't put much space for like lots of free text, because I thought that actually people might not have time. But what I actually found was that the SEND officers that we surveyed were so pleased that somebody had finally asked them something that they wanted to write loads. And that's what we found when the survey came out. I think we had one where they just did the ticky boxes and didn't do lots of free writing, but we had some officers that were just, so we got essays, which was amazing, and gave us a lot to work with, and that's what we've been trying to do. So that's how we've sort of developed the research. So it's been going for a long time. It's not sort of come out of nowhere, but suddenly there's quite a lot of interest around SEND assessment and review teams as part of the SEND and AP improvement plan, but we'll go on and have a look at that. This always makes everybody smile, the picture on the left, because this was the vision in 2014, that we would be doing person-centered planning meetings. We're all in a room with tea and coffee and the sheets up, and there is masses and masses of good stuff in that, and it's really person-centered and pupil-centered. But that we're in a very different world now. the numbers are very different. The numbers of assessments coming in are absolutely massive. But when we set out to do this research, we wanted to understand the SEND officer role. So what actually are SEND officers doing? And how, understanding how we're operating, we can start to work out other ways of doing it. We found we got lots of information about the experiences of SEND officers and the emotional impact of the role. So that wasn't one of our research questions, but it was something that we got from the officers. We wanted to focus on communication because we know that that's always been a key thing about how we communicate with parents and other agencies, and what are the barriers to communication. And then also training requirements. These came out of looking at the literature around what parents think about SEND officers. And some of the comments that came out were that they felt that SEND officers weren't appropriately trained. They didn't necessarily understand what it was like to be them, those sorts of issues. So we wanted to have a look at training. And then we also asked them about how they think they could improve the system and what that would look like from a SEND officer perspective. So all of this is from a SEND officer perspective. The last thing I just wanted to explain is, because there's always the question, what is a SEND officer? Every authority seems to have a slightly different title for their team, title for their workers, and different roles within each local authority. And so we sort of stuck with local authority SEND officers as the people that are administering the process of writing and producing education, health and care plans. And that includes the admin team that maybe take those first phone calls, the people that are writing the assessments and drafting them, but then also the people that are needing to do the preparation for tribunal, the complex casework, the mediation stuff. And there's crossover in all of those, which but we were trying to find a catch-all term because there isn't one. Even within our region, we couldn't find a single title that would actually cover everybody. So SEND officer is what we have stuck with through this, and SEND and assessment and review teams for the name of the wider team. I think it's over to you, Rich.
Yeah. So as Tracy said, she reintroduced the context of the research there. Basically there was an absolute dearth of research capturing the voices and asking the perspectives of SEND casework officers. Our research has 58 officers involved in it, all from 11 different local authorities and made up of a mixture of experiences and I suppose different kinds of roles as a SEND casework officer, ranging from first point of contact. 60% were we would argue with more sort of traditional sort of EHCP casework, and then 30% completing more complex casework, maybe dealing with tribunals, etc. I think this is really important. At the bottom of the slide there, more than half the respondents have been in the role for less than 2 years. So this shows that there's a great deal of churn within the sector, and it gives a sense of the kind of information that comes from the survey. That experience levels are lower than maybe in other sectors and so on. Now, if you can move on to the next slide, Tracy. So the early pilot study was really successful, and with gentle lobbying with the Department for Education to raise the awareness of that research, and conducting some workshops as well based on that initial pilot study, we found ourselves in the special education needs and alternative provision improvement plan. So if when you've got a bit of time on your hands, you can skip to page 53 and you'll see that some paragraphs relating to highlighting the need for effective casework within the whole system, but also you know, a need for developing new guidance and on delivering that responsive and supportive SEND casework service to families. So that was something that we were incredibly excited about. And I remember Tracy running into one of my lectures, waving the AP, saying, "We're in, we're in." Was that brilliant? So yeah, so we're in there. So we're making headways, we're making impacts with this research already. So this is a really nice sort of introduction to the findings, I think, because what this slide demonstrates is, you know, a real sense of what SEND casework officers generally felt towards their role, and in many ways, like why they did the job, you know. So these quotes talk about, you know, the importance of, or the rewarding aspects of the job, you know, and that's supporting and collaboration. Doing things well, you know, being a professional in the area, you know, the impact of the role, you know, and making a difference, you know, the love for, you know, providing that appropriate provision and planning for the child, and in some cases that focus on transitioning children from, you know, primary education through to secondary education, or to different provisions that are more appropriate for them, and really feeling a part of, yeah, you know, being a part of their future prospects and making a difference, you know. So overall, you know, this is a group of professionals that take a holistic and compassionate approach towards managing and supporting the education and development of SEN children, you know, and really emphasising that collaboration, that quality, that individualised care, and preparing for future transitions. I think more than that, or even more simplified than that, is there was a sense that they really cared for the outcomes of children and young people. That really came through the qualitative data that we found.
Okay, so we did find lots of positives that the SEND officers were sharing. I'm not expecting that you'll be able to read everything that's on this screen, but I know you're going to get the slides after. But these were some of the key findings that we had actually around the what is a SEND casework officer. This was about understanding what the role was. And actually, I think we came away less clear about what the casework officer or the SEND officer role was, but after having done the research. Because actually asking people what they were doing, we found that there was massive difference in what people were doing, not only between different teams within the region, but also within teams, and that there wasn't always clarity within a team as to exactly what the expectations of the different aspects of their role would be, particularly around that communication with parents. So whether they were out meetings with parents out in schools, or whether they were more based within the office, and what the balance of that looked like. So we started to unpick this a little bit. We found that 21% of our respondents had no SEND experience at all. We found a lot actually. I think it was something like 50% had been teachers, which is great. That's brilliant. And is really helpful in looking at the EHCP process, but not specific SEND experience. They also reported that they felt blamed when if anything went wrong, actually it was sort of the blame was on them, whether people hadn't written their advices in time, or whether you know, the provision wasn't being put into place, or all of these things they felt very much landed with them, and that led to them feeling that they were letting families down. And we've just shared that very positive slide, and we tried to keep this fairly balanced all the way through. But actually, when you read all of the qualitative data as a whole, it's quite negative is the wrong word. It's worrying actually for these people that are trying to work within this system. So they feel they're letting people down. They think that they're confident to challenge, they know how to, they know the processes, but actually the constant firefighting and needing to deal with stuff instantly is causing a high level of stress. And high level of stress and high caseloads are a significant issue, which then obviously impacts on how you can interact with your families, because you don't have the time. And we're seeing this from both sides, that families are struggling to get in contact at times with their casework officers, but the casework officers are overwhelmed by the amount that they have to do. But there is this desire for them to see the children and young people succeed. So this lack of clarity, and we did an event, by the way, in July where we got all of the sort of team leaders and strategic managers from the region came and visited us here, and we gave them a feedback about the research. And what was really interesting is there's very little information out there often on what a casework officer or a SEND officer is, what the roles within the local authority are, and what the different roles are. And that's something that some of the authorities were starting to try and tackle. But it means that actually, if you're dealing with more than one authority, or if a family moves authorities, the experience they get in one authority is not necessarily the same. It will be a very different experience in a different authority, because there's a lack of clarity about what these roles are and who's doing what and the approaches that each authority is taking. And they also felt that parents expected them to be able to solve all of the issues, that idea that they were blamed for the issues, but also that they could resolve issues that were in school, which is quite difficult. They also felt sometimes a little set up, as in that they were already blamed before anyone had ever spoken to them as well. As in, you know, you can apply for an EHCP, but you're not going to get it because of the fact that, you know, that's not the way the system works. And so parents will sometimes engage with a casework officer the very first time, already feeling that that we're up for a battle. And therefore that doesn't help working collaboratively, and how can, you know, what do we need to do, what are the next steps, what's been put in place. That's not the conversation they're having. They're already having a battle conversation because of the fact that that's the way it's been set up. They very much felt that other professionals had no idea what their job was. And I think we would expect that as there's a lack of clarity generally. We've got a different slide talking specifically around multi-agencies. But it's this idea that actually, if no one knows what they do, and if health and social care, as well as they said schools also weren't always aware what they did, if they're not aware of what they did, how do we know how to work best with them? And particularly the understanding of the statutory timescales, and that was quite a big barrier. We also then asked them, these are some of the things that they offered, actually, we didn't ask about this, but that lack of peer support, they talked about, and this is a bit of an offshoot of COVID, and the fact that for some of our SEND casework officers, now they are working from home. And I know there's been there's some hybrid working. Every authority seems to be doing it slightly differently. But what they've actually found is they're working in a high stress environment with high caseloads, and they feel isolated. And it's not always easy to get the support because everyone else is also very stressed and has high caseloads and is dealing with difficult situations. So there was this feeling of isolation and lack of support. They also 91% reported that they were getting some verbal abuse. That varied, and our complex casework officers that were doing tribunals felt that they got that more. They reported that as mainly being at least once a month. We only asked for more than 11 times. So again, it's this idea that they're feeling isolated and attacked almost because they're stressed as well, and they're dealing with people that have got really difficult situations that they're managing as well. This high turnover of staff doesn't help, because then we've got a stressed team who are then moving on quite quickly into other jobs. But the problem is, and again, this has come from some of the research about what parents feel about the SEND officers, is we've got SEND officers that don't know the systems particularly well. They don't know, and actually, you would get that if you've got a high staff turnover, then you're constantly trying to train up new members of staff, and what that training looks like is quite varied. And what we also found is that as soon as you've been in the role for a while, so if you've done it more than 5 years, you were in that more complex role, which we would expect. But it means that there's a gap in the middle of experienced EHCP SEND officers, and because that's where the churn is. And then you've got your experienced officers that are dealing with the really complex cases, but there isn't potentially the staff to be able to address some of those cases before they become so difficult at that end. Sorry, there's quite a lot on that slide, but it was a real it was a real eye-opener for us with regard to exactly what it was like for the casework officers, and actually that it was all slightly different. their experiences and what they were doing is different.
Yeah, and I think every single local authority, and within those individual local authorities, things were done differently. Anxiety, stress was all managed differently, and I'd imagine this what creates different kinds of practices. There's a strong sense of the SEND casework being a litigious process. We identified practices that showed how emails were preferred over face-to-face conversations, to enable more of an audit trail, and so on. And this all supports sort of that tribunal claim culture, which is kind of part of that adversarial sort of context that we're in. This slide here sort of goes on to talk just about, also demonstrate the varied nature of the role and the varied nature of understanding the role. I'd like to draw your attention to the quote on the bottom right, which says, this is obviously the perspective of the caseworker. So every caseworker works differently, but I feel that this is reflected in the plans. I think to be more effective, there should be consistency on these matters, more guidance on expectations to attend meetings and be out of the office. I also feel for parents, having someone not attend their meeting, but they hear others have casework officers always attending. So this really sort of like summarize, I think quite nicely sort of summarizes that actually, a recognition that people do work differently even within local authorities, and there's an injustice, there's an inequity within the system where some parents feel that they get a worse deal than others. Overall, in terms of the clarity on the role, the research demonstrated a misunderstanding of the roles and expectations from parents, schools, casework officers. There's inconsistency and a lack of guidance, as that quote suggested. They raised questions of a need for standardization and support with that. There are clear structural issues around the workload and time constraints. These sort of more supply side or more, there's an increasing amount of need within the children within this country, and this is creating increased levels of EHCPs being requested. And then other things around like stress and mental well-being of caseworker staff as well. Yeah.
Sorry, did I click
Over
on
to you,
click
Tracy. That's all right.
I'm just watching the time as well.
Okay.
So we then focused on communication. We asked specifically around how casework officers communicated with families, and then what sort of support they'd had to do that. So we actually found, because again, we hear a lot in some of the literature around parents' difficulties in getting access to casework officers, is they were saying that they can send an email and they don't get anything back, and it's that communication feels very difficult. Now, all of our, so 100% of our respondents communicated every day with families, either by phone or by email. So there is a lot of communication happening. It's just that because of the caseloads that the officers currently have, it's that communication isn't always responsive to the people that have needed to ring in, for example, or communicate, because there's lots of things going on at the same time, and that makes it incredibly difficult for the casework officers. We also found, though, that there were some officers that actually didn't, that maybe had really negative experiences. We've talked about some of that abuse over the phone, for example, that they've got. And so some officers reported avoiding that direct contact with families, because actually it was causing them such stress and anxiety, that actually they were really struggling, and it was affecting their health as well. So most of them had lots of contacts. 45% of officers had regular, which was weekly or more face-to-face contact, which is higher than I had anticipated we were going to get, actually. But I think that was a really positive thing. But we also had 19% of our survey that never had any contact with parents directly face-to-face. So again, you can see there's a massive difference in what people are actually doing and what the expectations are, and the time then to be able to deliver on what those expectations are. We asked around with school and education professionals, and they mentioned that actually if they're not communicating well with education professionals, the plans are poorer. If they're not getting the information, then that means that actually the plans are of poorer quality. They also said that sometimes staff will get really angry with them as well on the phone, and that's also really difficult for them to manage when they're just trying to administer this process. And they're not in charge of it very often. These are not necessarily the people that are going into panels to make decisions. They're just trying to present the information that is there. And they also had this difficulty, which I think we alluded to a couple of slides ago, that what happens is that the SEND officer almost becomes the mediator, and they've got school and parent who are trying to get the SEND officer to resolve the issue, which actually that they can't. You know, they're not, then it's very difficult for them to do that. So they're communicating through the SEND officer rather than with each other. And again, we've got these difficulties in actually getting information out of health and social care colleagues. That was a general difficulty, and it was difficult to. It was also difficult because they were trying to, if parents have had a negative experience in the past of social care involvement, then they're not necessarily happy with having that involvement, even to ask the questions around the needs for the education, health and care plan. So they were also some of the challenges around communication. So we wanted to ask then, what are you doing? So there's supposed to be, so there's a thread of co-production, although the interpretations of co-production I think vary, and they vary within the SEND code of practice as well, and then what's been written subsequently. The SEND and AP plan has more around co-production on an EHCP level, so actually how are we collaborate working together and co-producing the EHCP for a child. Whereas we know that within the code of practice that co-production is really mentioned with us at a strategic level about the systems and processes that are put into place. So I think there is a real lack of clarity. What do we mean? What does it look like? And how much are we doing of it? So we asked them what that looked like, collaborative working, and they were really confident in working with families, collaborating with families. That was not an issue. And we asked them the benefits of person-centred work, and they could say that they talked about the plans being better, it was clearer, the parents were on board, but then they also said, but we don't have time to do that. So we know it's the right thing to do, we know the plans are better, but actually we don't have time. And that was a key issue. There was also a real lack of understanding of what were collaboration and co-production. What do we actually mean? So the SEND officers, often they were just talking about ringing to give a decision, and that was an example of collaborative working. And I would question that is an example of collaborative working. That's just giving information. So it was interesting to try and unpick what that actually meant and what this sort of co-production actually meant. And what we found is there was a real lack of understanding around that. We also found that they reported two complete extremes. And again, you know, I've worked really closely with my SEND assessment and review team, and I've been in these situations and in these meetings, which can be exceedingly challenging for everybody. And that is, you either have parents who have a lack of understanding around the system that they're in, and are struggling to sort of manage that system. And then they also have other parents who are very knowledgeable about the system, and they're trying to work out how they communicate effectively with the parents that are not understanding the system, but the officer is trying to get the best for that child, alongside those parents that are very knowledgeable about the system and how they can get also what is appropriate and right for that child. It's remembering in here that it's always around the needs of the child. It's about putting in the appropriate provision and getting the needs of the child met, and it's trying to keep that focus. So one little quote that we had here from our research is that barriers to this collaboration could be the ability of families to understand the process through language barriers or familial need, but also some families may be knowledgeable and try to influence your plan writing. I think that's quite interesting because parents should influence plan writing if it's done in a co-produced way. I don't think that's what they're trying to talk about here. They're talking about sort of trying to impact and put things in that there isn't necessarily evidence for. And that's some of the things that we need to unpick a little bit more. So we have really contrasting experiences. We have tried to keep the voice within this presentation. We've tried to keep the voice of the SEND officers in here so that we're really showing you that this is what they've said, and because of the fact their voice hasn't been heard. So the one on the left here is that the expectations of parents are extremely high and they're really confrontational and challenging at times. This feels really tough sometimes when it's the opposite of who I am and what I try to do for every family. They also feel their child is entitled to anything they request just because they have an EHCP and won't always listen to rationale or reason. This is actually somebody who had been in a SENDIAS role, so supporting parents, and had moved into the local authority and was actually really struggling. And you can feel the emotion, I think, within that as to the difficulty that person is having in trying to administer this system in a fair and equitable way, but also not feeling able to do so. And then we've got the person on the right who put, when you know that the EHCP has been written has led to the child and young person getting the right support in the right setting, attending reviews for that young person that you've been involved with for several years, been loads of progress. You can see the happiness in them and their parents, and being able to speak to parents when we're doing phase transition to let them know they have got the choice of school for their child. And that was the most rewarding aspect of the role. And you can see that that's much more child focused. It's much more around the needs of the child and the relationship, and it feels much more positive. So we've got these real contrasting experiences that are being shared about actually what it is to be a SEND officer.
So this is sort of continuing the sort of the working with section. So here we're looking at this slide's talking about the sort of the matches and the mismatches SEND casework officers perceive when working with schools and education professionals. So they emphasised, the confidence in working with schools and education professionals. They were confident in facilitating multi-agency meetings, although due to increased demands, had a lack of time to attend those. The caseworkers emphasised the importance of working collaboratively with schools and education professionals, and that was vital for the effective management of SEND cases. There's a high level of confidence, as I said. There was challenges with miscommunication. So a significant issue is miscommunication, which sometimes leads to SEND team being prematurely blamed for issues before any work is completed. This possesses challenges in maintaining effective collaborative working relationships. There was also issues found around understanding the statutory obligations, so school staff's misunderstandings, such as the perception that school staff often do not clearly understand their statutory obligations, such as providing timely advice. There's often delays reported in these areas, and again, there's a sense, a perception that these were incorrectly attributed to the SEND team. There's a lack of clarity perceived amongst the casework officers of school staff regarding who is responsible for ensuring that provisions in the plan are put in place. I think this is something that came through quite strongly. So who's accountable for the plan once it's made, and for implementing reasonable adjustments within the school system. So that's more along the lines of, when the CHCP is put in place, is the school acting on that? But equally, like, are there just general inclusive practices in the school that can help limit children needing an EHCP in the first place? They also talked about the difficulties with school placement. So this caseworkers face real challenges or perceive real challenges in allocating children to specialist placements. There's a lack of specialist placements perceived by the casework officers. So overall, they perceive this really complex, challenging environment within this particular relationship, where casework officers perceive being blamed, as Tracy said before, This is more sort of research to sort of demonstrate that. But they feel confident in working with schools and education professionals, which is good. Next up is looking at working with health and social care professionals. So the caseworkers perceived a general lack of understanding over what they did in their role. They found challenges with statutory obligations, such as information being provided in timely matters. Again, they felt that this impacted on their regulatory requirements. They perceived themselves as being undervalued by this particular set of professionals. And they made a series of recommendations, such as SEND officers suggested that health and social care professionals needed clearer guidance and training on their role to help support in the development of EHCPs on time. This includes understanding of what to include in health and social care sections of the plans, as there are currently significant variation in the level of detail provided. They also perceive that training on their statutory, that there would be a need for training on their statutory duties regarding the EHC plans process, and also recommended to ensure a more consistent and effective approach. So this is really great because it's showing that casework officers have a voice, and these are things that can be taken up by healthcare professionals, healthcare leaders, especially when we're thinking of a holistic approach in the health and well-being of children, not working in silos, working in a multidisciplinary way. So the SEND caseworkers perceive significant gaps in understanding and collaboration from health and social care professionals. They recommend further training, clearer guidance, etc.
Okay, so we then asked them about what training they'd received to be able to do the role. Because again, this had come up through the literature around what parents' experiences of working with SEN teams were. So we asked them, and actually what we found is access to training was really patchy. Some got nothing at all. They got maybe local authority. I've probably nicked my next slide now. I have. They got local authority induction training on how to use the systems and apply for leave, but they didn't get any training actually on what the job was. There's the majority of training is on the job training, which is absolutely fine, but it does mean that there's a real difficulty with what the consistency of that training is. And also we've got this massive churn of staff. So if you've got new staff every 2 years, then potentially how are we ensuring that the quality of what the new staff are getting is actually of good quality? And what does that look like? We don't really know still what good looks like, and we'll come back to that at the end. So some SEND officers said they did have access to training, which was great, but they didn't have time to actually access it. We had one authority, so we did the analysis by authority initially and then across authorities to see if there was anything different in specific authorities. And we had one authority where all of the new officers, once they got into post, did the NASEN level 4 or level 3 or level 4 SEND qualification. So that was actually really good. But I'm going to talk a little bit more about that as well. They also said that there's training out there for other people. So there's things that parents can access, there's things that advocates can access and SENDIAS, but they're either not accessing it because they don't have the time to access it, or it's not necessarily open to them. So we really did find that there was very little training. The training they did get the most of, which you'd expect, was actually around the writing of EHCPs. What they didn't get any training on, we tried to look at some of those softer skills. So we looked at communication, whether they had any training on communication with families. We looked at co-production, person-centered planning. Some of this they'd had years ago because I remember going through the launch. The 2014-2015 was very busy with training for those of us that have been around for that long, because I remember going to outcome sessions and person-centered planning sessions, but they were one-off sessions. And then actually the staff now is a completely, I walk into the SENART team now in my authority and I don't know most of them. So actually all that training that I had in 2015 that we did jointly actually as an EPS and a SEN team, there isn't that knowledge isn't shared now. So the fact that it's all in-house means that there isn't a level of consistency, there isn't a standard that we know that everybody is getting to, and that we're and as we saw with regard to person-centered planning and collaborative working and what that actually was, it's very different to what when I think about collaborative working, it really is about sitting down together to say, okay, what are we going to do? What needs to be put into place together as a conversation? And that sort of isn't necessarily what SEN arts or SEN teams are seeing. And it was interesting that some of that collaboration was seen to be that because they had all of the advices are sent in, that was a collaborative process because of the fact that the advices are sent in, even though actually there may not have been lots of conversations around that. So with regard to this training, we've got things like, most of the training came when I was working elsewhere and not actually for a local authority. And this is what I was saying about, I've jumped the gun here. I'm not very good at following slides. When I began this role, I didn't have a manager in place, working alone from home. I was not introduced to any of the team except the other casework officer who'd covered the area for a month. A caseload of 375 young people handed over to them, a caseload that no one had done anything with since the previous casework officer left 2 months before. I had no training on the filing systems, how they wrote EHCPs, or anything relevant to my job. The only training I was given was the generic council training that everybody had. So again, it's no wonder that we're getting inconsistent responses, when we're talking to parents and families, if actually, if you're not really clear on what the role is. I also had someone come onto my SEN course who was a TA on doing the PG cert, and she came into the SEND officer role, and I was sharing my research. She sort of came up and said, I've had exactly the same thing, completely different authority. She said, that is what I've had, that I've had no training, nobody's actually shared what it is that I need to do, but I have all this work to get done. And then we have the opposite, which is I was offered and started this level 4 qualification, and it's been extremely valuable. So that's actually something that is really helpful, but you can see here the inconsistency of what officers are getting across, and this is just within 11 local authorities. So the recommendations that came from them. One of the key things that they were asking for is actually can we have some clarity on what this role is and how do we do it? And that was quite interesting. Is it an admin role? And we did have one person in particular that I remember reading through their responses was really clear. They were a casework officer, so they were writing EHCPs, but they were very much saying, my job is to write the EHCP. It's not to do that. It's not to go out and see families. It's just to do this. Right to the other extreme of people going, but I want to go out and work more collaboratively with families. So at the minute, there's a lack of understanding of what this is. And therefore, if you don't know what actually the job is, how do you know how much time the job takes? And we know, I know all I seem to do now is write advices because of the number of requests for statutory assessment that have come in, which have got absolutely phenomenally increased over the recent sort of 12 or 18 months. So how do we actually know how long this job takes, and therefore how many people we need to do it if we don't actually know what the job is? And also some of this was predicted back in 2014. There was some research that was done by Lupton and then following by Hill in 2014, looking at the workforce development. I would really recommend actually that you go and have a look at them. They were the Pathfinder reports of looking at workforce development, because a lot of these issues that we're actually seeing, they basically predicted in those reports, to say things like, are we aware of what size teams need to be, exactly what the job is, how do we clarify, are they taking on a key working role, and what that looks like within a local authority. So then when we're clear on what the role is and we understand caseloads and expectations of the role, it's easier to then communicate that out to families so that families actually know as well what to expect from the casework officers, as do schools, as do health and social care. And then they wanted some greater support to actually do the role. This feeling of isolation was a real issue. And also feeling that people can treat them however they like, and that they are not able to do anything about that. That came through as well, and they were asking for training. And it was that was interesting, because I wasn't sure that would be the case, but they wanted dedicated formal training, mentoring support. They wanted it to be standardized training, so that they knew that what they were getting is the same as what the people in the authority next door were getting. And if they were doing complex casework, additional training for complex casework around that work. One thing that was also interesting is that they said they wanted the training to be interactive. So not this sort of thing in a way, but actually working together and supporting each other in an interactive way, as opposed to, they felt that some of the training that they get at the minute, when they've accessed it, it's quite dry, and it doesn't, they're not necessarily helping them to improve what it is that they're doing. So really interactive, and thinking about that communication with parents, understanding of a range of special needs, those sorts of things that they don't actually have at the moment.
Yeah, and I think like we're sort of coming to the end of the sort of introducing the research, the other findings of the research. This slide is just talking to you a little bit about the limitations of the research, or also like what the research didn't look at, or what the focus of the research is. So in this case, it was just focused primarily on SEND casework officer perceptions. So we didn't include other key stakeholders like parents, teachers, health and social care professionals, or the children themselves. These are all things that could be researched in a similar way, and to provide additional knowledge and perspectives on what's going on at the moment, especially within this COVID or within the post-COVID context. It's a fairly limited survey, and 58 officers participated in it. We're looking for this study to expand across the entire country, beyond the north of England, and to capture views from other local authorities across the UK. And yeah, I think also that, as we said before, not all local authorities took part in the same sort of way. So we had more casework officers from specific local authorities, and to the range where we had very few casework officers from some local authorities. But yeah, I think down the line, I think the research can expand further to really unpick some of the qualitative aspects and findings, go into a bit more depth, have a much broader nationwide study as well. And I think then we can really pick up more traction and really get that SEND caseworker voice into the main arena. It's an important voice because it's so interconnected with all the different disciplines, and I think, yeah, we should really be looking at taking this further. And that's what the next slide would be looking at. So, from this research, this research evidences the need for change in the area, from increased multidisciplinary collaboration, greater community and parental engagement. There's a need for education and training. There's needs for standardization and consistencies, enhanced communication channels, support for casework officers, in developing professional networks, professionalizing the sector, a focus on long-term outcomes, and raising community awareness and advocacy for the role and understanding of what that role is. Some of the things that we're doing now, over the next, I'd say now because it's over the next year, is some of those things. So to improve improve community, professional community, an increase in knowledge sharing, in developing those initial sort of training structures. We're developing a SENDAR conference in March. This will include raise our recognition for the professionalization of the role, increased peer support. There's an opportunity for training, and we're going to get some really great speakers coming to work. And it's also an opportunity to platform the research that we're doing, and also other researchers that are also taking part in this SEND, or capturing SEND casework officer perspectives as well. And the next slide.
Yeah.
Oh, yeah, we're on that. Go on.
Yeah. So I'm just aware of the time as well. Just that comment actually about it is only 58 officers. We have done a presentation of this down in London and as I say across the region, and we found that it did resonate with the people that we were speaking to, and actually there was one team manager that spoke to me to say it's really nice to know that it's not just us, because we are working in our, everybody is working so hard within their local authorities that it's not always easy to see across that actually other people are having the same issues. But that's also why we need to look at it more systemically, because we are all having the same issues, so we need to look at that more clearly. So one of the things that we're doing is a review of the training that's ordinarily available. So what is out there? So we know that there's the level 4 that people can do at the minute, and then talking to some of the officers that have been on that training, and then actually seeing what impact that training has had for them. So how that's done, how that's improved their working. But we're also trying to look at these softer skills, which are in those documents from 2014, thinking about those communication skills, person-centered planning. What does that mean? We need some clarity about how do we do that, and then understanding. I have a child who has medical needs, so I don't get a lot of sleep. So I know that I can be a bit ratty at times if I haven't had a lot of sleep. And it's sort of that understanding of what it's actually like as well if you are a parent of a child with special educational needs and the impact that can have. But also then how do we work better together to take account of that? Because it's not okay for me to be, sort of shouting at other people, but I do know that sometimes I have less tolerance because of the impact of having a child with additional needs, and just the strain that puts on you as a parent. So we also need to have a look at young people's perspectives and how actually we can bring that in, and have a look at what that impact is for them, and when the process moves smoothly, what does that actually look like? Which then just sort of takes me on to our last slide, which is we actually don't know. There's no evidence at the minute of what a supportive and responsive SEND team actually is. What does it look like? How does it function? We're all trying to put into place what's needed for the legislation, but actually we're all doing that in slightly different ways. So we've got some further research plans. So some is within the region, which is to talk to a few of the officers that have maybe taken part in the survey and try to dig a bit deeper about some of the things they were saying, and gain more detailed insights. We're also going to be doing a presentation like this to our parent carer forum and talking to them about actually how we can work better together in order that we are developing a system which takes all the people into account within that system. And then we're looking at trying to expand the research to see what does good practice look like. And I think there are different criteria for good practice. I know when I've been to a few of the DFE talks, they've been looking at, authorities that have low numbers of EHCPs, low numbers of tribunals. But does that actually lead to, is that a supportive SEND team? Is that a part of that process? Or are there other things that we need to be looking at? Are there other authorities and ways of working? So we are incredibly interested if you feel that your local authority works really well and is a supportive and responsive SEND team, and you feel that you work really, please get in touch, because what we're wanting to do is start to visit and look at these authorities that have evidence that actually things are going pretty well within their authorities, to then try and work out what are the elements that actually make a supportive and responsive SEND team. Because at the minute, all we found within our research is it's completely inconsistent. Now, we have some theories. I've just seen that last question. Yes, we do have some thoughts on like what that might be, but the issue at the minute is we don't have any evidence for that. And what we need to do is start to look at where there is good practice and identify what the elements of good practice are, in order to then share that wider. Not that we would all become the same SEND teams, but that actually what we're doing is showing the principles of good practice. So when we're looking at communication, what does good communication look like? There's an example in the SEND and AP improvement plan, but actually, is that in more than one authority? Does that work? You know, what are the demands on that authority? We need to unpick all of that at the minute, but that is definitely something that we're going to be working on. So thank you.
Thank you, Tracy and Richard. Tracy, I think you have to jump off shortly, don't you, to go to another commitment? Is that right?
I do. I've got my SEND group are actually in today, but we're all right for a little bit. They're all set up.
Okay. So I think you've obviously got a sense from the chat that what you've said has really resonated with people on the call, and thank you also for agreeing via us to share your policy brief, which we will send out with the slides and the recording. And thank you too for sharing your contact details, which was very generous. I've been looking at the chat and I think you've addressed most of the questions, but we have had one come through from Sylvia just asking, do any Ofsted inspection reports highlight examples of good practice?
I've been reading them recently, specifically looking for evidence of good practice. I'm trying to think. There's one. I was looking from the new Ofsted framework that's just come out, so I was looking at the ones from more recently. I will get back to you on that, because off the top of my head, I can't remember which local authority it was. But very often, the thing that's really interesting reading the Ofsted report is the SEND team as a team, again, is not mentioned. And for me, that just misses the process. Is only done by the people that work within that process and those systems. So yeah, it's often not mentioned, SEND teams.
Thank you, Tracy.
Specifically.
Are there any other questions that people would like to put to Tracy and Richard about their research? This is your opportunity. Richard, I think you're going to be able to join one of the breakout groups. Is that right?
That's right. Yeah.
Yes.
Really.
So I'm going to just open up to give people an opportunity to raise their hand, to put in the chat if they would like to jump in, to make a point, to feedback on their group's discussions, or to raise a question. It's your opportunity, so it's open to whoever wishes to make a contribution.
Can I make a contribution, Kate?
Go for it, Richard, and then I'll go to Laura. Yeah,
well,
thank you.
So my group really developed. The conversation became more and more alive. Emma spoke about her MBA research and how she sort of found some needs for greater clarity in standards. You know, who does what, health and safety, health and social care training was a common theme. You know, what is expected. Sam talked about the importance of workload and, like, you know, what is actually expected of a workload and what is an appropriate workload, and to do with like time, working out, you know, how long it should take to do different activities, and then that being sort of maintained in practice. Laura from Manchester talked about expectations of parents need to change, and then there was conversations about how that could happen with the use of, like, you know, offering videos. There were suggestions that from Sarah that Worcester local authority might have some really good videos guiding parents on the SEND caseworker role, and just the experience of having your child receive an EHCP process. Yeah, and this Shauna sort of explained that what they did in, I can't remember which authority Shauna worked in, but they explained the graduated approach with parents, and they found that really eased anxieties. You know, being transparent about the processes again really helped with parents. And Laura from Manchester came in at the end with the kind of really fantastic point about actually the well-being for casework officers and how they're dealing with, you know, really significant real life, real world anxieties, relationships, you're dealing with threats, but also that kind of like vicarious trauma, you know, the trauma of hearing about how children are and how unwell they are, you know, and that they're clearly not, SEND casework officers are clearly not admin staff. You know, they're professionals dealing with complex cases. And I think it was Shauna, excuse me if I got the wrong name, came back in and talked about, well, actually, you know, there's lots of conversations with schools and so on as well. You know, Senkos, head teachers, etc., etc. You know, there's always that sort of like firefighting, that negotiation, those difficult conversations with external professionals. You know, that's what really came through in my group.
Thanks, Richard. That was really helpful. So I can see that there's a Laura, you were offering to come in as well. Were you in Richard's group?
Yeah, I'm in a different group, but I can feedback.
Thank you.
Hopefully I'll cover everything. Yeah, so it was really useful. We have lots of people in our group from kind of different backgrounds and different kind of levels, kind of different roles. I think one of the things that came through is maybe differences between local authorities. So some have got really good kind of links with health and have kind of people in specific roles to really support with that, and that's really helpful, and they can be involved in a lot of decision making, whereas other kind of local authorities might maybe not have access to that. I think as well, you know, kind of a lot around clarity of role and kind of how that's communicated to different stakeholders, because we were saying maybe what schools think are, you know, the role might be and what parents do could be quite different, but obviously how we communicate that to them in something that's kind of easy for them to understand, and you know, what evidence do they need, you know, what are the processes, what are the timescales, who does what, you know, so maybe something that could be shared with those kind of different stakeholders, just to kind of cover what everybody's role is, what everybody does, what they need to do, what, you know, what would be expected. Because then it is really difficult, you know, when you can't, you know, you're saying no to issue a plan, and you know you've got a really distraught parent, but we've got to kind of follow the law and things like that. So that can be quite difficult, and also just kind of higher, maybe above, making sure that maybe what we're doing on kind of a ground level and kind of operationally is kind of shared with kind of those above, so they've got a clearer understanding of kind of maybe the challenges that are faced by kind of the different roles.
Thank you, Laura. That was really helpful. Does anybody want to come in from one of the other groups just to sort of flag any additional kind of thoughts or comments over the ones that sort of Richard and Laura flagged? Anybody want to just mention, say in the chat if they fancy just jumping in? No, I can see, Hannah, you've referenced the importance of your group highlighting sort of induction and legal training for everybody, so have a consistent approach to sort of the legal frameworks, etc.
Yeah, we talked about the IPSI training being particularly good, and that it was really good if areas could do the SEND casework training, but also the parent carer forum being on the same training, so that they had a share, you know, more shared understanding of the framework that we're working to.
That's a helpful comment, having an opportunity for doing shared training with your sort of leads from your parent carer forum, so that you've got that kind of mutual understanding. Yeah, no, a really sensible suggestion. Thank you. Sam, do you want to sort of come in then in relation to sort of feedback from group 2? Can't hear you just yet.
How about now? Is that better?
Yes.
Super. Sorry about that. I think one of the additional things that we spoke about was, as well as the kind of systemic issues around, you know, fiscal backdrop and special school places, EP delays. I think there was something around the way that these teams are structured that was referenced within our group. So is it helpful to have annual review specific officers, or is that part of the kind of wider role? And then we also spoke around, as has kind of been mentioned by lots of people already, that training that's available currently, and what could be done to make that training more suitable and more in line with the job roles. And I think one quote was, which I took away, was it's not necessarily about the numbers on caseload, and there can be a huge variety of what that really means and looks like for case officers, other than simply 250 cases or 125. So yeah.
Thanks, Sam. It's really helpful. Yeah, an important point, isn't it? It's not number, it's kind of the complexity and the weight that might make a difference to how you sort of manage caseloads. We've got 1 more minute. Is there anything else that anybody wanted to add before we move into our next discussion? No? Okay. Thank you. So I'll move us on to our next agenda item, and Macy's going to talk us through some of the reflections that have been pulled out of the regional SEN case team manager workshops that the CDC has been hosting and managing. So this kind of builds on what our discussions have already happened and kind of looks at where they resonate with the themes that have been pulled out through these workshops. So thank you, Maisie, over to you.
Brilliant, thanks, Kate. So hi everyone. My name's Macy Ray Reid. I'm a programme officer at the Council for Disabled Children. I recognise lots of names of people here today. So yeah, it's really great to see you all. So as Kate said, I'm just going to talk us through some of the key themes that have been shared in the regional SEN case team manager workshops that the Council for Disabled Children have been running over the last month or so. So just to give you a bit of a background to the workshops, so earlier this year, the CDC held a couple of focus groups with SEN case team managers just to agree the sort of key priorities for them and their teams at the moment. And I think this really nicely links in to the research done by Tracy and Richard as well, in that they were mentioning that what came up in their research was around the emotional impact of the role on people. So we did a prioritisation exercise. Obviously, lots more things came up, but out of that prioritisation exercise, we came up with these 2 key themes that case team managers wanted to work on. So one of those was that team managers wanted to feel more equipped to build and support their team's emotional resilience, and that also team managers wanted an increased knowledge of some sort of time management and prioritisation techniques that either they could use or that they could support their team to use in sort of managing those really busy workloads like we've heard lots of already today as well. And so we developed some content and we've been delivering those sessions by a regional approach. So I think we have done, as of yesterday, 7 of the 9 regions, and we've had about 150 case team managers join those workshops. And what those team managers were really keen to do was network with each other and sort of find out what other people are doing within their regions that's working for those with regards to these 2 areas that I've mentioned. So I'm just going to share some of the key themes that have come up. And I'm aware that there's probably a few of you in the session that have contributed to these sessions as well. So thank you for that. So if we start with how are people building and supporting their team's emotional resilience. So I've kind of organised this into 2 categories. So you've got the more formal support, which is the things that lots of us know already. So things like the employee assistance programme that most workplaces offer. Some local areas spoke about them having internal wellbeing teams. So having dedicated people that sit outside of the casework team that are sort of responsible for helping people with their wellbeing. Linked to that as well was internal wellbeing resources. So having maybe an online library of resources that SEN case team managers can use to sort of refer to and support their team. And as part of our sessions, we developed some really helpful resources. So I'm more than happy to share those resources with the slides and everything else that we're going to send after today. And then you've got other things like mental health first aiders, and sort of the more obvious things around supporting work-life balance. So really sort of taking into account the personal lives of case workers, and sort of thinking about how you can manage them to support work and home life by, you know, offering hybrid working, which I think the majority of us probably do now, and also supporting people around care and responsibilities as well. But two of the really key themes that came up, which I'll go into a little bit more detail of, were supervisions. So both case supervisions, but also wellbeing supervision. So lots of areas spoke about having that one-to-one support with their employees, just to sort of really focus the conversation on wellbeing, and sort of starting those conversations around their well-being and what's going on for them and what's impacting that, and just keeping that really high on the agenda. So always starting conversations with a focus on well-being before sort of going into the more things about what's actually going on in terms of a workload perspective. And one area sort of spoke about their staff formulations that they've been doing, which we thought sounded really great. So this area sort of sit down with their individual employees and work out a bit of a formulation. So it's a personalised, individualised approach to supporting each employee. So looking at things of how does that caseworker best like to work? What conditions do they like to work in? What are some of their maybe emotional triggers in the workplace, and what can help them when those things come up? And just sort of really looking at that, and even looking down to the more practical things like when are you most likely to get things done? You know, is it in the morning or the afternoon? And just sort of really putting in support around that to help get the best out of the staff. And then in terms of informal support, you've got things like social events that lots of people are doing. And also I thought what was quite nice about this as well, that doesn't necessarily have to be outside of work time. So lots of teams are sort of making sure that they're having team lunches and things like that, and just making sure they're getting together to have like a tea or a coffee or a cake before work, and things like that, just to sort of regroup. One team said that, in fact, I think this was a common theme amongst a few teams, was around just saving positive emails into a separate folder so that people can look back on that at times when they're not feeling so resourced. And I think with the sort of really challenging conversations that lots of you have said that people are having with schools and with parents, that can be a really nice thing to sort of reflect back on when you're not feeling so great. Lots of managers spoke about open door practice, so making sure that it's really clear that they have this open culture, and sort of really trying hard to foster that open culture with their employees. So making it very clear that, you know, they're there and they're available to support them. You've then also got things like team building, so making sure that people are having regular team meetings and away days. And I think this goes for this point, but also going back to supervisions, is that it's really difficult to make time for these things. But I think it's really worth sort of mentioning that when you do make time for this, it really does help to support the team. And I think, you know, things like supervision and team building, they can sort of be the first thing on your agenda. If you're needing to save time, they can be the first thing that gets cut. Yeah, what was really clear in the sessions is that it's really important to make time for these. And ultimately, when you're giving staff an opportunity to have those supervisions and those away days and team building activities, it will really help to resource them going forward. So that was something that came up in the sessions as well. Another couple of things just to mention were stuff like buddy systems. So especially if you've got new members of staff, sort of buddying them up with somebody else, probably somebody in a similar role to them, or at least a similar banding, so that they've got somebody that they can go to sort of on a peer level for that support, and physical activity as well. So a few areas were sort of talking about their wellbeing walks that they do on lunchtimes and things like that, and also offering things like yoga and stuff. Cool. So moving on to time management and prioritisation. These were some of the key themes that came up, and actually one of the points I'm going to focus on is what Sam mentioned was discussed in their breakout room. So making sure that caseworkers have allocated focus time, so making sure that they've got, you know, maybe 1 or 2 allocated days a week where they are really focused on plan writing or something like that. And some areas spoke about doing like sort of a phone rota, so that they give their caseworkers an opportunity to have that 1 day a week where they don't necessarily have to answer those phone calls. And I think that also links back in really nicely into the building emotional resilience as well, because it's sort of giving those employees days to sort of feel more resourced, I think. Ensuring a fair workload. So one area spoke about rag rate in their cases. So just like we heard from the breakout room discussions, it's not about the number of cases. You know, you could have 100 cases, you could have 200 cases. But this area we're really speaking about regularly rag rating their cases and sort of allocating work to caseworkers based on that. So working out exactly how much time and resources needed to support that case, and just making sure that they're regularly allocating cases fairly in that way. High level case management, so supporting individuals with those on the back of that rag rating on those higher sort of red cases, making sure that they're putting in case management in a more proactive way, so that issues are addressed sort of as and when they come up, rather than you know, sort of waiting until it gets to crisis point, I guess. And just a couple of more practical ways that people shared that they're doing things is having interim deadlines and working backwards. So sort of plotting that final deadline on their calendar and working with their team member to sort of backdate their diary and work out exactly when certain things need to be done, and just sort of prioritising that backwards, really. And I think that's also a really great way to sort of help employees feel more resourced, because it's about sort of less about that big end goal and more about how you get to that end goal. Shorter meetings as well. So instead of having the 1 hour meetings, scheduling those meetings for about 50 minutes. Just gives people that 10-minute break. Obviously lots of us back to back, and I'm sure some of you have got meetings to go to after this as well. So it's about just allowing people to have that 10 minutes just to feel more productive in their next meeting. And also having shared to-do lists. So one area, or at least one area, spoke about that they sort of have a team approach to their to-do list. So they share that to-do list and they work together to work out what's urgent and what's important, and how they can all support each other to work through that. So those were the key themes that come up. There was lots more that came up in the sessions, but in the interest of time, I've shared the sort of key points that were raised. And yeah, I just wanted to say thank you again. So thank you to the 150 team managers that we've worked with so far, that sort of have spoken about these ideas for informing the presentation. Yeah, and then I've also included, I'm aware that I've maybe run over by a minute or two, but I've included our RISE team email, so you're more than welcome to get in touch there as well if you have any questions, or if you'd like to find out more about the workshops. But thank you for listening. I'm going to stop sharing my screen.
Thank you, Macy. And I think that we can see in the chat that that was encouraging some people in thinking that they were working along those lines in the way that they were operating their service. We've got literally a couple of minutes. If anybody does have any kind of thoughts or questions or comments based on the discussion that Macy's just led, now's your opportunity to sort of jump in. Does that resonate? Is there anything else that you'd like to share that you're working on? Any questions that you'd like to ask? No? Okay. Thank you. We will move on. Oh, Richard, thank you.
Oh, sorry, yeah, I just wanted, yeah, my computer's running really slowly and randomly kicked me out. But yeah, I just wanted to say, like, I thought that it's really interesting, the findings on your workshop, particularly around the importance of supervision and that taking a more tailored approach to staff. You know, these are sort of things that are really fundamental to trauma-informed practice, you know, creating supportive environments for people, you know, being interested in the person, finding out what works for them in terms of their working environments and practices, you know. And I think this would definitely fit in within a trauma-informed model of working. There were some people in the chat that were talking about good practices and things. I'd just like to say again, you know, if there's any sort of examples of good practice, please email me and Tracy. I'd really love to hear about them, and it's sort of things that we can keep in mind, you know, talk to when we're presenting, you know, and also can enable, you know, us to think about new types of research, etc., etc. So please do keep in touch and let us know what you're doing.
Thanks, Richard. That's
Thanks.
really helpful. So I'm going to draw our morning to a close to allow us time, as agreed on the agenda. I'll start by thanking again Richard and Tracy for a